Hello everyone, I hope that you're in good health. My name is Vimal and I'm CEO of LiYF Limited. LiYF is a healthcare company that specialises in premium healthcare supplements for weight loss, fertility, PCOS and also cell protection. We all know that COVID-19 is a viral pathogen that causes severe morbidity and mortality. To date, there is no approved or licensed vaccine or antiviral medicines that can be used to either prevent infection or treat COVID-infected patients, or even be used for their aftercare when they recover. Here at LiYF, we've been working with task forces around the world to research COVID-19. We would like to share our findings as we believe they can significantly improve your body's immune system and help you fight the virus. Please note, these prevention protocols are not a cure or a vaccine or treatment for COVID-19. We strongly recommend you follow medical advice and government guidelines. So we've been asking the question, what can we do to protect ourselves and stay healthy? The first step is to develop these habits. Wash your hands. This is still the #1 prevention protocol. Wash your hands with soap and water for 20 seconds before eating, touching your face or being with other people, or especially when you return home. Soap is the ideal anti-coronavirus cleanser because it destroys the virus's protective envelope. Avoid antibacterial soaps. It will not kill the virus and will only damage your skin's microbiome. Use caution with objects or surfaces that are possibly contaminated. Avoid touching metal surfaces, doorknobs or elevator buttons with your hands. The following cleansers will kill most viruses, including coronavirus, on hard surfaces. 70% alcohol, 0.5% hydrogen peroxide, 0.1% bleach. Make sure you clean doorknobs, phones, keyboards, credit cards and keys daily. If you are sick, please stay at home. Stay at home and invest in a surgical mask to protect yourself and other people. Gargling. Gargling with a mouthwash or a mix of toothpaste and water can help kill the virus before it enters your system, as these contain suffocants, compounds that lower the surface tension. Quarantines. Quarantines will delay the spread of infection and also reduce the burden on the healthcare system. But unfortunately, we believe most people are likely to be exposed to COVID-19. However, there are measures you can take which will diminish the likelihood of severe illness if you are exposed. These are not treatments for disease, they are preventative strategies to place you among the 80% with mild to minimal illness, the 80% who have the greatest chance of succeeding if these preventions are taken before exposure. So, sleep. A good night's sleep is necessary, as this is when your body produces melatonin, which is an anti-inflammatory and has potential use in adjuvant therapy for COVID-19. Your body makes melatonin at night in the dark, and children make much more melatonin than adults, which may be one reason why they are more resistant to COVID-19. Exposure to the sun. This is the best way to naturally produce vitamin D, which is crucial for the body's immune system. The World Health Organization recommends a minimum of 10 to 30 minutes a day of sunlight. Meditation. Practicing meditation has several benefits, including reducing the severity of psychological disorders, stress-related ailments, increasing immune function, and delaying the progression of various diseases. Fasting. Several clinical studies confirm that fasting improves the body's immune system. Practicing intermittent fasting followed by alternate day fasting is highly recommended. Exercise. Physical activity helps to flush bacteria out of your lungs, decreasing your chances of getting a cold, the flu, or other illnesses. Exercise reduces levels of the body's stress hormones such as adrenaline and cortisol. Exercise also stimulates the production of endorphins, chemicals in the brain that are the body's natural painkiller and mood elevators. The National Centre for Biotechnology Information clearly states that regular aerobic exercise is associated with improved ACE2 function. ACE2 is the receptor for COVID-19. Yoga. People who have been practicing yoga, meditation and pranayama have experienced a higher level of immunity and lung strength, making it difficult for the virus to affect their bodies. Yoga asanas are a good way to improve your body's physical fitness, but there are also specific asanas that can help boost your immunity as well. Prana. Prana is the life force in our body. Pranayama means the exercise of increasing the life force in our body. Increasing prana in our body can tackle many diseases and, more importantly, even prevent them. Breathing techniques. Dan Brule and Wim Hof are world-renowned pioneers in the field of breathwork. Most of us breathe in and out at least 23,000 times a day without skipping a beat or paying it any attention. Breath is life. It is something we can all do better. Our diet. Many natural products have shown anti-coronavirus effects in clinical studies. The following foods can help with the prevention of COVID-19. Vitamin C, guavas, oranges, grounded flax seeds. Amla, popularly known as the Indian gooseberry. Amla is an antioxidant and a rich source of vitamin C. Amrut, also known as giloy, is an immunity enhancer. Asafoetida, hing. This has already been used in China for the treatment of COVID-19. Tulsi, also known as basil, is very effective in treating upper respiratory and lower respiratory diseases as it has antibacterial and antiviral properties. Turmeric has anti-inflammatory and antibacterial properties and has the potential to prevent cancers, Alzheimer's and heart diseases. But turmeric also gives a massive boost to your immune system. Black pepper boosts immunity and prevents the body from contracting forms of the cold and, in effect, coronavirus. Sugar. Reduce your sugar intake, as sugar reduces your body's immunity level. Simple. And this is very important. The lung damage of advanced coronavirus, pneumonia, is due to an overactive immune response. These immune boosting therapies should only be used for prevention or early stage infection. They are not for severe illness. Supplements. These supplements may address the actual biology of COVID-19 and also the human immune response. But once again, they are not treatments for infection or disease. For killing the virus, asafoetida, hing. For supporting ACE2 in COVID-19, curcumin, resveratrol, rosmarinic acid, alpha-lipoic acid. For mTOR inhibition in COVID-19, resveratrol, quercetin. For inhibition of 3CL proteins in COVID-19, fresh grounded flax seeds. Vitamin D3, you can have up to 5,000 IU a day. Elderberry, this works best if taken before exposure and during the early stages of infection, but please stop elderberry if you are sick for more than 3 to 4 days. To enhance your innate immunity, vitamin C if you're not getting enough through your diet. Vitamin D3, once again, you can have 5,000 IU daily. Curcumin, preferably with pepper or high bioavailability like BCM95. Giloy, melatonin. Ashwagandha. Very recent research has shown that ashwagandha can block COVID-19 from entry through the ACE2 receptor. Antioxidants. The best antioxidants to take are coenzyme Q10 or ubiquinol, resveratrol, zinc, vitamin C, and vitamin D. Antioxidants are generally classified in 2 broad categories: water-soluble and lipid-soluble. Our body needs both types of antioxidants because each one targets different types of cells and tissues. Water-soluble antioxidants are present in aqueous fluids such as the blood and intercellular and extracellular fluids. Resveratrol is considered one of the best water-based antioxidants. Lipid-soluble antioxidants, these are localized to cellular membranes and lipoproteins. They protect cell membranes, and ubiquinol is considered one of the strongest lipid-based antioxidants. The body needs both types of antioxidants to fight and help neutralize pesky free radicals, and when taken together they are very effective, increasing the body's natural energy. A synergistic blend of ubiquinol and resveratrol can be found in RevitaLiYF UBQh-R. So what have we learnt about COVID-19? We have found that 80% of infected people have minimal symptoms and do not seek medical attention. 15%, however, become ill or severely ill, and unfortunately 5% require intensive care. We know that men are more vulnerable than women. We know that COVID-19 is shed in stools, so foodborne or waterborne infection is possible, but not yet demonstrated. We know the virus remains viable on surfaces for several days, but the spread of infection from touching contaminated surfaces has also not yet been demonstrated. This being said, it is advisable to clean surfaces to minimize the risk of infection. The incubation period for COVID-19 is 2 to 14 days, with an average as 5 days. For 80% of people, the symptoms typically last for 5 days and are followed by a full recovery. Phase 1 is the milder illness, and for 80% of people, it is the only phase. For 20%, however, phase 2 starts after 5 days with a cough, shortness of breath and symptoms of pneumonia as COVID-19 attacks your respiratory system. Mortality increases with age and is greater in people with underlying health issues such as high blood pressure, diabetes and heart disease, to name a few. So it is vital we protect these people. So healthy young people need to take the same precautions their parents and their grandparents take if we are to control the pandemic. It is also not yet known whether recovery from COVID-19 infection produces immunity to the virus. I would like to thank you for your time. The main aim of this video is to empower you to live a longer, healthier life, and that this information creates a positive influence on your well-being, especially now that our health is of vital importance. Please keep in mind that we can all live a healthier life. Follow medical advice and government guidelines on COVID-19, but most of all, stay safe, stay healthy. Please look after yourself, your loved ones, and those that are vulnerable or in need. Thank you.